my name is Elspeth Graham and I'm a Genetic Counsellor in Aberdeen. I work closely with families impacted with Huntington's disease, and welcome to this SHAYP Talk on predictive testing for Huntington's disease. As you may know, people who are at risk of developing Huntington's disease can take a test to define whether or not they will develop the condition at some point in their lives. If you're considering finding out if you're at risk of developing Huntington's in your life, then this talk will explain the whole process about what to expect. So why is genetic counselling important before you take this test? For me, I think it allows the person to consider the implications of receiving a result, and also for them to consider the impact it would have not only on themselves but for other family members. It's an open space for us to talk about your feelings and emotions and any concerns that you may have, and it allows us to explore and clarify your understanding of what the condition of Huntington's is. It might be helpful to know that there are a set of guidelines that help to structure the genetic counselling process. The purpose of the guidelines is to inform the genetic counselling process throughout predictive testing. It has been agreed with medical, scientific and patient representative input. It helps to provide a consistency and also a bit of protection about what will be covered in each of these sessions. And it might be that people, whilst deciding if they're wanting to test, might move different areas, so they will experience the same process regardless of the centre that they attend. One of the key guidelines stipulates that a person should be 18 years or over in order to undertake a predictive test for Huntington's. The reason for this is that Huntington's is in general an adult onset condition, and there is no treatment needed to be started prior to this, but most importantly that they are of an age where they can make this decision for themselves. If you want to know more about the guidelines, then speak to your SHAYP advisor. So if you're thinking about being tested, you're probably wondering how would you go about making an appointment. For most people, we would recommend that you go through your GP, because I think it's helpful that your GP is aware of what you're undertaking and what you're considering. Other methods, you could approach your SHAYP advisor and they could refer you to the clinic, or you can self-refer if your family is already known to the local clinical genetics department. So what can you expect when you come along for an appointment? I think on average you will find that you'll have at least 2 to 3 appointments, and we follow the guidelines where they ask that we keep at least 4 weeks between each appointment. This seems like quite a long time, but actually it allows you to think more fully about the things that we've talked about in the first one. Maybe even to chat it over with your family or friends or your SHAYP advisor, which would be a good idea. There's a lot to cover, so I think that gap in between allows you to think more deeply about the issues. The average appointment's about 50 minutes, sometimes an hour, and that can be quite a long time actually when you're talking about yourself and having to think about the implications of the test. So you might be wondering what sort of questions and topics we'll cover in the appointment. I do have some topics that are important for me to cover with you, and those are really just to clarify your understanding of Huntington's disease. I know that you'll have talked a lot with your SHAYP advisor and perhaps your family members and your doctor about it, but it's really helpful just on a one-to-one opportunity to ask questions that you maybe aren't that too sure about, and I'm happy to help with providing you the answers. It's also helpful for me to ask you about your discussions that you've had within the family. Have you been the first one to think about being tested, for example, amongst your siblings? And what are their views as well? We talk about things like what would you do in employment? Would you have to tell your employer? Would you need to not think about going on to do studying or working in particular areas? We talk about options that are there for you in the future when you're thinking about having family, and also even about driving. So there's lots and lots to talk about, and I just think having these several appointments with little gaps in between just give us the opportunity to think about what we've talked about and to maybe think up more questions. There are always questions, and I for one am happy that people come and talk as much as they need to. My goal is not only to cover certain topics with you, but just to make sure that you are as ready as you possibly can be to get this result. I'm not going to try and persuade you either to do the test or not to do the test. Good and bad results affect people in many different ways. You can perhaps think about coming on your own for the first appointment, because you might still be just at the inquiry stage. You might be wondering, is taking a test the right thing for you at this time? And so I'm happy that you come along alone. But for future appointments, and especially your result appointment, we would encourage you to bring those people who are closest to you, and the person that you would trust and speak to most about having the test. By attending, you're not committing yourself to having a test. You can use these appointments to just explore and ask any questions, and you can dip in and out at any time. So you might come and ask a few questions, and then not see the counsellor for another 6 months, then come back again. That's absolutely fine. Please take your time, be honest with yourself about how ready you are to know the result, because remember, once you've taken the test, we can't unknow what you then know. So when we're thinking about doing the test, we generally take a blood test, although we can use a saliva sample. The sample is then sent to the laboratories, and on average it takes about 3 to 4 weeks for the result to come back. At the time of doing your blood test, we'll also discuss how we give the results to you. I tend to make an appointment so that the person can keep that day clear and be absolutely certain which day they'll receive the results. We always pass them on in a face-to-face, so it'll be a clinic appointment again, and you can decide whether you receive your results on your own with your support person waiting in the waiting room, or whether you want them with you at the time. At that point, you'll have waited long enough, so my tendency is to bring the person into the room, ask their name, their date of birth, and then give the results to them. The options for the results will be that we have a negative result, which tells us that you will definitely not develop Huntington's disease, or a positive result, which definitely will say that you will, at some point in your life, develop Huntington's. Having a positive result doesn't tell us when or how the condition will develop in you. We also have this grey area where either you will develop the condition but much later in life and perhaps with milder effect, or that you will not develop the condition but perhaps future generations through you will develop the condition. What we discuss in the clinic after that is entirely up to you, and you may wish to just leave the clinic and come back at a later date. Following on from your result appointment, you'll be offered another one in approximately about 4 weeks. Regardless of whether you have received a positive or a negative result, these appointments are helpful for you to discuss how you're feeling. And especially if you've been given a good news result but you're aware that your siblings have still to be tested. With a positive result, you will probably be introduced to either the consultant or genetic counsellor or nurse who's responsible for the management clinics. At both of these appointments, we'll also talk about the participation in any research, in particular Enroll-HD. So hopefully this SHAYP talk has helped you understand a little more of the genetic testing process involved with Huntington's, and that in conclusion I'd like to suggest some top tips to think about before you inquire. Do take time to carefully consider the implications. Do seek support with someone that you trust, and especially to say that you're thinking about testing. Please take as much time as you need in order to make your decision, and make sure that your decision is yours alone to take the test. Thank you very much for listening. Bye.